full mounting, we did the Taylor Liberator as well for the tethering. Had you had subcision prior to that?
Never had subcision, no.
And you only had the TCA cross, hadn't you?
I had about 6 or 7 sessions of that. Right. Which made a bit of an improvement, but I think there's a threshold of that, and you don't really go beyond.
The punch excisions just bring that much more.
A little bit, exactly,
And in terms of, obviously there's the sort of, from 2022 to 2023, I was dealing with this sort of phenomenon of cheek fullness post-Taylor Liberator. Now we did quite a comprehensive one on both sides. We released quite a lot of scarring on both sides. How are you feeling about your face shape right now?
Yeah, I mean, my face shape feels like it was before, so I don't feel like it's changed any.
Do you feel chubby cheeked?
No, I don't. No.
Do you feel sort of that your jawline is gone or anything like that?
Not at all. Not at all. I would say that the microedema from the laser took a bit longer to subside, but that wasn't from the Taylor Liberator. And
you mean the skin
just a little bit
puffiness?
That puffiness went down, but I think pretty much 2 days after the Taylor Liberator, my face shape felt like it was pretty much back to normal. Once all the whatever you put in. Once all of that sort of dissipated.
Movement's all fine.
Movement's fine.
Numbness was a little bit for, usually a couple of months you get a little bit of numbness.
A little bit around here, but that's also come back fully now.
Okay.
The feeling, so I had a little bit of numbness probably a couple of months in, but I'd say for me, like the 9-10 week mark, I noticed a big change in the redness, the swelling, and the numbness. At that point for me, everything changed.
So 3 months on now, you're feeling pretty back.
Yeah, so I'm about 3.5 months on. I went snowboarding for a week at week 13.
Yeah.
So had a face mask on, the goggles, was in the sun, wore sunscreen, sun protection, factor 50. Still used a cleanser and a moisturiser. And
back to daily.
Back to normal. Yeah, and I exfoliate once a day or once every other day, and didn't have any issues at all when I was away. I thought I might when I was skiing, or snowboarding, but I didn't have any problems at all, which I was really pleased about. So I feel like at week 10, things pretty much like fully settled for me. But I know it's 3 months generally. Recommendations.
And degree of improvement, what would you say? I mean, it's a difficult one to like perfectly quantify.
I probably need to see like a really clear before and after. But I mean, I would say the Taylor Liberator is probably about 20-30% in terms of like the tethering. And like I said, in some lights, I don't even notice the scarring now. So
and then
I would say like
an
80%, maybe 80%, 70-80%.
So reasonably where we pitched it.
Yeah, absolutely.
And when you saw the photos of what we kind of do, you say, that's a realistic sort of feeling that you can achieve. What we showed there. We've got about good 70 cases there on the site. When people ask me what 70% is, I tend to say, well, look at the cases, look at your type of scarring. Would you say that was a fair analysis?
Yeah, I think so. I think when you have scarring and you've tried different things like the TCA cross, or people try microneedling or laser and all that kind of stuff, not the fully ablative laser, you kind of like are hopeful for more of an improvement, but then inevitably you don't get that. Whereas with this one, because it's so extensive and so thorough in terms of like untethering the scar patterns, like punching out deeper scar.
There's a logic to it. It's a surgical logic.
Exactly. So you kind of know that there is inherently going to be some more improvement than what you would have done before. But when it actually happens, you're like almost kind of like believe it, because most people who've got scarring will have lived with it for quite a long time when they get to this point. As had I, and I accepted it, but I felt like when I came across your treatment, why not?
So you feel that there's change at the end?
100%, yeah, and I feel a lot more confident that I've had it done. I'm grateful I've done it. I'm grateful for your help with it all. I think more people who've had it should consider it. We've got scarring should consider this sort of treatment if they're willing to go through the recovery process.
You have to be ready for it.
That bit's the hardest bit. Just